So let's go back to this birth defect thing. So last class I talked about this neuron tube defect, and as I said, the most common one is this one called Spina Bifida. And so here there are three types of Spina Bifida, and they are called Spina Bifida Occulta. Yeah, it's a little bit hard to pronounce, but meningocele and the myelommeningocele. So these three types actually varies in their symptoms. As you can see in the first one, the Spina Bifida Occulta, only a small gap in the spine was found, and there's no opening sac or any fluids or exposure or anything. So this is the most mild one, and the middle one is called this meningocele. There's a sac of fluid but it's without the spinal cord. So this is called a meningocele, and the most serious one is called this myelommeningocele, which is to the right here. You can see the spine, and there's a protrusion of this sac with fluid and spinal cord and those nerves. So usually these, if a baby has this meningocele, it will have some disabilities later. And causes of spina bifida are still unknown. Generally, they are caused by interaction between multiple genetic and environmental factors. But some studies have found that this MTHFR gene may be related to the spina bifida pathogenesis. This MTHFR gene actually encodes an enzyme, which is this reductase, which participates in the folic acid, this folic cycle or folic acid utilization by the body. And that's the only factor people know about the cause of spina bifida. And how do we test and diagnose these diseases? So most of these methods are actually quite similar to the one I talked about for testing and diagnosing this Down syndrome. So, for example, this blood test, people can look at this alpha-fetoprotein, AFP, and a high level of this AFP will indicate spina bifida. Also, we have this ultrasound method, which we can actually look at the image of the baby to see if it actually has a protrusion at the back. And this is a more straightforward way. And the other one is this amniocentesis. It will take a small sample of the fluid, amniotic fluid surrounding the baby, and this high level of AFP in this fluid may indicate this spina bifida. Treatments are usually some are actually not quite treatable. They just need to cope with it. But for some recent studies suggest that for this myelommeningocele, for example, an article published in this New England Journal of Medicine, they found if they do a clinical trial and compare this, how this child will be able to walk without crutches, or so how the child will behave in later life if they do this prenatal myelommeningocele repair, or they do this repair after birth. So they found that it's better actually to do this prenatal surgery, which means when the pregnant woman before she actually gives birth, they do an operation or surgery to actually remove this protrusion and try to repair this myelommeningocele, and it will actually increase the chance this child will be able to walk without crutches later. So basically, if this can be done, they usually use this surgery. And the second type of neuron tube defect I want to talk about is this anencephaly, which is 1 in 10,000 babies. It's actually can be considered as rare. Basically, the principle is similar. As the neuron tube forms and closes, it will helps the top of the upper part of the neuron tube will help to form the baby's brain and the skull. And this anencephaly will happen if the upper part of the neuron tube does not close all the way. It's a very serious type of neuron tube defect. So basically, the baby is born without parts of the brain or scalp. And usually, this is known during the first months of pregnancy. It can be detected, and unfortunately, this because it doesn't have any brain, and the brain is important for life. So almost all babies with this anencephaly will die almost 2 or 3 hours very shortly after birth. And this is a picture of this anencephaly here. And as you can see, this is the formation of the neuron tube. And top of this is forming the head. And if this part fails to close, the anencephaly will happen. And if you compare the normal child, the skull line is actually here. The normal skull line is here, and this is one child with this anencephaly. It's missing that most part of the brain, although it still has a brain stem, but most part of the brain is missing. So it will be not quite possible to survive this. So the last one, neuron tube defect, is this encephalocele. It's 1 in 5,000 babies. It's also a failure of closure of the upper part of the head, but the location is a little bit different. So you can still see the formation of a head, but we will have an opening there, so it will form a sac-like protrusion on the back of the brain, and sometimes it will form actually in an area between the forehead and the nose. Again, this is also a neuron tube does not close completely type of defect. So this is neuron tube defect is mostly not quite treatable, and how to prevent it or minimize its risk of giving a baby of having neuron tube defect. And people have already found that if you let pregnant women take folic acid from a certain period every day, this folic acid can prevent most cases of this spina bifida. And this is the most important nutrition for pregnant women. Although other nutritions like vitamins, dietary and herbal supplements are also important. And also you want to avoid overheating your body, and if you have fever, treat it. So why is folic acid so important? Because it's also a type of vitamin, actually called vitamin B9. One of the most important reasons is it can help to form the body's DNA and RNA. So during this development period, it's vital to have this DNA RNA regulation in control. And that's why you want to let pregnant women to have this folic acid, plenty of these. So the third one I'm going to talk about is this mouth and facial defects. So first, some little bit background of this facial development. Actually, if you imagine the development of a baby, at first it does not even have a face. So when it becomes when the head actually forms during the pregnancy, later it will form the face, and the procedure is basically the cells on each side of the head will grow towards the center, towards the center of the face. For example, like this, these two bulbs here are actually related to nose, and this small, what is this, gray area to each side, these are actually the eye. They will actually grow towards the center to form the nose and form the eye. And the other parts of the head will help to form the lip, palate, mouth, stuff like that. So if any of these process goes wrong or have errors, it will have those facial development failure or have those defects. One of the most famous ones is probably this called cleft lip or cleft palate. This happens like 1 in every 700 babies. So basically this cleft lip, if you look at it right here, it's forms between this 4th and 7th weeks of pregnancy. It happens because the tissue that forms the lip does not close together, so there's a gap there. Or this cleft palate, which is the roof of the mouth, which actually it's very close to the lip, but it's inside. So the roof of the mouth fails to close together, so it forms a cleft there, like what you see in the right picture here. There's a cleft. These two types are usually talked about together because they are so close. And what treatments can we give? This type of defect is actually very treatable. Usually, if you perform this surgery very early, it can improve the appearance of a child's face. And also, if there are some other problems like breathing, hearing, speech, language development problems, it can also be improved. As you can see in this picture here, this is to the left here, it's a cleft lip, and to the right here, it's actually repaired. You can see it's almost normal. And these are some mild ones. Actually, if you have those with orofacial clefts, like they call it orofacial clefts, because the cleft opening is actually wider. As you can see, the opening is only local, like very close to the mouth here. But if the opening is wider actually to the nose or eye area, it's actually a very big opening. For that type of cleft, it's actually harder to repair, and more treatments and service are needed. And but for this simple cleft lips or palate, it's very repairable and manageable by surgeries. So the next one is the limb defects. It's related to the limb, and the most common one is called club foot. 1 in every 1,000 babies. So some information of this club foot. It's also called congenital talipes equinovarus or CTE. This actually it's the symptom is this foot actually is rotated internally at the ankle. As you can see in this picture, this is a normal one. This is the rotated club foot one, and to the right of it, it's the club foot picture. So when these type of baby walk, actually it appears that they're walking using their ankle because it's rotated. This ankle is rotated. These causes of this club foot are largely unknown, but this, people found that it may be related to this type of PITX1 and the TBX4, this transcription pathways. And for this clubfoot is also, with treatment, it can be recovered almost completely. So what type of treatment can we give? Usually there are 3 methods depending on how severe the clubfoot is. For the more mild ones, you can use this called Ponseti method or French method. So Ponseti method involves stretching this clubfoot leg and do some casting gradually to correct it. And this French method is the stretching, taping, and splinting. So basically, the principle is to gradually fix this foot into normal position, like each time by rotating a little angle. Yeah, as to the right here, you can see this. It's using different cast to try to correct this clubfoot. From this clubfoot to the normal foot. And if it's more severe conditions, those stretching treatments will not work, so you have to do this surgery, which means open the back of the leg and correct the correctly either lengthen or shorten each side of these ligaments. Another type of this limb defect is called polydactyly. It happens 1 in every 500 babies. From its name, you can actually tell it literally means many fingers. Or sometimes it has many toes as well. And basically means normally we have 5 fingers for each hand, and for polydactyly it has, the people with polydactyly has usually 6 fingers. And this additional finger may happen in different places of the hand, and depending on that, we call it different type of polydactyly. And if it happens on the smaller finger side, for example, in this picture here, we call it this is the most common one, we call it ulnar polydactyly. If it happens on the thumb side, actually, if you look at this picture here, there are 2 thumbs here. Although this is less common, so we call it radial polydactyly. And if it happens in the middle of the head, it's called central polydactyly. There are actually various forms of this polydactyly, and depending on how, because some of the fingers have extra fingers have only tissues, not bones, and so it will classify this polydactyly according to those criteria. But I'm not going to go into details there. And some potential genetic causes, people have looked at the formation of fingers for rats and small rodents, and they found that these mutations in this sonic hedgehog, this is a protein gene, actually will cause this polydactyly. Because as this SHH gene plays a very key role in regulating this organogenesis. To the right here, you can see for the normal hand formation, the SHH expression actually only on one side of the bud, the limb bud. So this is a limb bud. It will form lots of fingers later. And for this, if there's a mutation there we will see a little bit more ectopic expression. So in addition to this bigger purple chunk here, the SHH will also express here in a small portion, and this one will actually, this expression will cause the addition of another finger. I think it's because when they study this type, because these hedgehog genes are it's a family. There are many hedgehog genes, and when they study these specific hedgehog genes, when they look into a microscope, they found like the cell have some spikes. It looks like the spikes of the Sonic, because it's a cartoon character, right? Sonic, yeah. So that's why they call it Sonic hedgehog. There are also 2 other types of hedgehog, but the name is not on top of my head, but they are all hedgehog genes. Yeah, so that's why it's called Sonic and abbreviated as SHH. Okay, so let's see. Treatments. So for treatments, in this case, we usually do surgeries here, and depending on how the extra finger is located, you don't do different types of surgeries. For this radial polydactyly, which means this extra finger is at the thumb location, like thumb duplication. Usually we take out one of the fingers and maintain the other, and which is the one, usually we maintain the ulnar thumb, which means the thumb is more closer to the little finger, because that one is better developed and stronger. So maintain that. And for the ulnar polydactyly, which means the extra finger is close to the small finger area, it's actually very frequent in black children for some reason. It will be usually treated by simple excision of the extra finger. And this is the time period the surgery is usually performed at 6 to 12 months of this age. Okay. Okay, so lastly, I will talk about this congenital heart defects. So this is actually a very common birth defect. Usually it's abbreviated as CHDs. Some people also abbreviate that, also call it congenital heart disease, but since we are talking about birth defects here, we use this term, congenital heart defects, CHDs. It's a very common one. It happens 1 in every 100 babies. It's a large collection of all sorts of defects, because the heart structure is actually very complex, as you can see here. This is the structure of a normal heart, and to the left is a static picture of the internal view of the heart. Okay. So you can see there are actually 4 chambers here. You probably have already learned the right atrium, left atrium, right ventricle, and the left ventricle. And they are each, the left and right are actually separated, and the up and downs are actually separated by valves. And normally, they function like this, like the body to the heart. Yeah. So the what is this? The oxygenated oxygen is flowed to the right atrium and going to the right ventricle, and from the right ventricle it will go into the lung to get more oxygen, and to the right heart, actually this is the right heart, to the left heart here, the oxygenated blood will go into the left atrium, and then it will go through this valve into the left ventricle. And from the left ventricle, it will go to the aorta and to all parts of the body to make sure they have enough oxygen to metabolize. So as you can see, it's a very complex structure. It has chambers, those veins, aortas, arteries, and those valves. And any of these components, if any of these components go wrong, it will have this congenital heart defect or CHD. So depending on the location of this defect, there are multiple ones. So basically this congenital heart defects are the defects at birth, and it will affect the structure or the shape of the baby's heart and also its function, so the way how it works will also be affected. Usually it affects how blood flows through the heart, because the heart is basically the central station for the blood circulation, to make sure the body has enough oxygen. And also it varies from mild to severe. So the mild ones are like a small hole in the heart, in which place that it doesn't meant to be a hole there. There's a small hole. This is still mild, but if there's a missing part or a poorly formed part of the heart, this condition will get more severe. And so as always, most of the congenital heart defects, the causes are largely unknown. So there are several types, major types of congenital heart defects here. So for example, this atrial septal defect and all of these defects, they are all related to the missing part or any dysfunction of the valves, or too narrower of some veins or arteries. So there are too many types here, but in this class I just want to introduce 3 of them here, which is the coarctation of the aorta, the pulmonary atresia, and also the ventricular septal defect. So the first is the coarctation of the aorta. So basically, if you look at if you look at this aorta here, normally if the coarctation, the narrowing is not present, this dashed line is the case when if the defect is not present. So it's much wider. But the coarctation, if the coarctation is present, it's you can see this type of the tube is much narrower than the normal one. So this will cause problems to prevent the oxygenated blood to follow from the heart to the body. And so it's a very critical congenital heart disease. It needs surgery immediately after birth. And the second type of congenital heart defect I want to talk about is this pulmonary atresia, so related to the lung. This basically is a type of tube here, PV. So this basically means it's missing a PV, which is a pulmonary valve. This valve controls blood flow from the right ventricle to the main pulmonary artery and back to the lung. Basically, this deoxygenated blood is here, and it needs to flow back to the lung to get more oxygen through this pulmonary valve. And if this valve is missing, there's no way for this to go back to the lung. So it will have trouble for this blood to pick up oxygens, and it will cause various symptoms. It needs surgery immediately, like, for example, adding an extra tube here. So this is the third type of birth defect, the congenital CHDs. I want to talk about this ventricular septal defect, or VSD. So basically, it's a problem of because between the right ventricle and the left ventricle, there should be complete separation here. But in this VSD, or ventricular septal defect, there's actually a hole in the wall or septum separates these the two lower chambers or ventricles. So imagine what this will cause. And yeah, so if you compare, this is a normal heart. There's no the separation is here. There's no hole, and with this hole down here, if there's a hole between right and left ventricle, the oxygenated blood from the left ventricle will follow to the right ventricle, so causing the mixing of deoxygenated and oxygenated blood. This will cause problems because this type of blood in the left ventricle is supposed to be pumped to all parts of the body for functioning. But if some of this is leaking, then which means some parts of the body does not have enough oxygenated blood. So, and the heart sometimes may need to pump harder or work harder to compensate this issue, and it will cause the enlargement of the heart, and eventually some heart failure problems, and also hypertension problems, and lots of problems. So this type of defect actually also needs to be repaired like immediately after birth. So for these CHDs, I also want to talk about some diagnosis, because this is a little bit different from this genetic defects diagnosis. So basically for the CHDs, usually during this pregnancy, we use this ultrasound, this imaging system to take a look at the baby's heart to see if it has normal formation. And this is usually called a fetal echocardiogram. And you can see this to the right here. It's a typical cardio or this echocardiogram. Basically, it can show the location of chambers like right, left atrium, right, left ventricle. And if there's, in this case, if there's a hole or leaking, you can see there's a discontinuity here, because the original wall should be pure white. But if there's a leak, then it becomes black. The density is different. So this basically means it has a VSD, or ventricular septal defect. And it's not only limited to VSD. This can be used to diagnose various different types of congenital heart defects. And also, one needs to be aware that some CHDs are actually not detected later. So some of these can be detected even before birth. But some other CHDs are not detected after birth, until after birth, or later, even in childhood or adulthood. So this is diagnosis, and how do we treat some of those congenital heart defects? Basically, surgeries, because we don't know the reasons, we don't know the causes of these defects. We can't possibly use any gene manipulations or anything like that. And normally we perform these surgeries to treat these congenital heart defects. To repair their heart or blood vessel, or repair the hole. As you can see in this picture here, for this actually summarizes two types of defect in this picture. And for this VSD, or ventricle, there's a hole between right and left ventricle. This VSD here, we usually need to apply a patch to close this hole, so there won't be any mixing of the oxygenated blood and the deoxygenated blood. And that's for the VSD. And for the pulmonary atresia, like this missing valve, usually one needs to apply this tube here to connect it back to the lung tube. So this, before, this is after this operation. So make sure that the oxygenated blood can flow normally back to the lung. And sometimes we can also use another type of method called this cardiac catheterization. It's basically a long tube called catheter. It will be inserted to the artery through the blood vessel. Usually inserted through the blood vessel into the heart. It's a very small tube, so it can go through this blood vessel. And in using this method, this doctor can actually take measurements, take pictures, because they may have some small camera on the top of the tube, and also do tests or even repair the problem. For example, one of the best example here is some of the narrowing or the blood vessel issues narrowing can be repaired using this stent. So in which case they insert a tube, and on top of the tube there's a balloon. There's a balloon which can be inflated if it's in the right place, and then this blood vessel can be expanded, and so it's not narrow anymore. The blood can flow like normal. And finally, I think I'm going to summarize this class. So basically, in this class, I give you a brief introduction of this birth defects, what it is, and how is this formed, how common is it, and what kind of treatments or diagnosis can we do. And actually, one of the most important thing is the prevention. So, prevent it from happening before it happens. Do something. For example, like the folic acid taken by pregnant women during pregnancy to prevent. They found that this can prevent over almost 80% of this neuron tube defects. So prevention is also very important. So basically 3 points here to take home. And the first one is this birth defects. You will have different various forms. It affects nearly almost all parts of the human body. Because remember the graph I showed you earlier, the sensitivities of different organs in the developmental period is different. Like the central nervous system is actually more sensitive to birth defects across all the pregnancy timeline. So, and also the second point is birth defects have complex causes. It includes both genetic, even epigenetic and environmental factors. So some of them have definitive causes like this trisomy issue because it's very obvious. But some of them are not totally understandable or appreciated, such as the congenital heart defect. So the interactions between genetic and environmental factors are also playing very important roles here. And the third point is these risks of many birth defects are actually quite manageable. We can taking certain measures to prevent some of them from happening, or minimize the risks of getting those birth defects. And also, many birth defects are quite treatable, either by taking medicine or doing this surgical operations. They can all be treated. And so that's basically what I want to talk about today. And so the final exam schedule, I'm sure you're probably already being informed, but I just want to say it here again. It's the January 19th, so I believe it's next Monday. Monday, it's January 19th, and 1 p.m., so afternoon. And, what's that? That's actually, yeah, I heard from Wang Hao. He actually told me it's 1:30, but I confirmed with some other instructors, and we look at the table, the official one, it's 1 o'clock. Yeah, so this is official. I've also have this confusions previously. It's 1 p.m. January 19th, and it's F2305. I believe it's the same floor. So I don't know if maybe David Saffron, Dr. Saffron will give you some review session. He actually talked about that, but so that's it for today, and I think thank you very much.